Hi, this is Ting from Hazelton Physical Therapy, and we are here today to demonstrate a interesting new technique that we've been utilizing to help tight or loosen soft tissue and muscle spasms, and can be very effective at reducing pain and healing from injury as well. The technique is called Myofascial Decompression, and it's based on an ancient treatment technique called cupping that a lot of people may be aware of. But it's been adapted to physical therapy, where we incorporate it with normal movement patterns that can help maximize the benefits that you see. The way that myofascial decompression works is that it actually works on the fascial system of the body. When injuries occur to the fascial system, your structures in your body tend to kind of get stuck together. They dry out, stick together, causing what we call adhesions and scar tissue. So what the myofascial decompression does is it stops the compressive forces that happen, and it starts to lift the structures of off each other, so that the flow of fluid and stuff can start flowing again, helping muscles relax and pain reduce. So we're here today with Amy, who is, say hi Amy.
Hi.
And we're going to go through a little treatment techniques just so people can see what myofascial decompression looks like. Amy told me earlier today that she has some tightness in her neck muscle, especially on this side. So what we'll do is we'll do a quick treatment technique on this left side to see if we can get Amy looking at feeling a little better. So first of all, Amy, if you could just tilt your head right and left for me, just so everyone can see the tightness there. And tilt your head to the left. So you can see the right side is a lot freer. The left side is a lot freer. There's a bit of restriction going to the right and the left. So myofascial decompression is based on these little cups like these. And we use a pump to create some negative pressure and some a vacuum inside the pump, so that will pull on the skin. So the first thing we'll do is just put some cream on there, just so we can get the suction a little better. And I'm going to hit 3 or 4 different trigger points in the upper trapezius and the later scapular area. Trigger points are areas of knots in the body. It's like a muscle spasm. And trigger points can be a major cause of pain and stiffness in the body. So I'm going to pump this up a couple of times, okay, just to make sure I get some skin, and you see through there that it's starting to turn red. That means it's starting to create some pressure on the structures below, and it's separating the tissues that may be stuck, or scar tissue that's adhering to her structures underneath. The second point here, we're going to come out closer to the shoulder, and the same thing, I'm going to pull a couple of pumps in there, and again you'll see that the skin is starting to pull up inside that cup there. And the final point we're going to hit is in the upper trapezius here, and Amy has a not so big neck, so there's not too much room for the suction cups there. And this last one I'm going to do is up in here and through the neck area. So what the cups are doing now is, if you could imagine when you're injured or with muscle spasms, the layers of tissue that you have under the skin are starting to dry out, and they kind of get stuck together to each other. And the stickiness causes the difficulty with moving, and when you have difficulties moving, it creates pain. So what this does is it's starting to separate the tissues and lifting the structures, so that one, it starts stretching the scar tissues, that's bonding the adhesions, and 2, it allows the flow to start flowing through the structures again. So after a couple of minutes of being on the skin, I'm going to get Amy to start incorporating some movement into it. So I'm going to get Amy to just tilt her head to the right for me. And as she's tilting, she may start come on back again, she may start feeling a stretching sensation to where the cups are. And what that does is it starts to stretch the fascial system, stretch the structures underneath, which is a positive thing for tightnesses. So if I could get you to do that again, Amy. And then back to the middle again. And go right, and look down, and then back to the middle again. This one doesn't want to stick too well, but we're going to be persistent, and we're going to put it back on. Okay, if you could do that 3 or 4 more times for me, please, Amy. That's good. And then back up. So tilt to the right, and look down, and then back. Tilt to the right, and look down, and back. Tilt to the right, look down, back. So we're going to have Amy just do that maybe 5 more times for me, please, Amy. And all the time I'm looking at these structures here and seeing that they are starting to get a little red, which is kind of what you want. You want the soft tissue to start stretching out, plus you want the circulation to start to flow. I think I'm going to give up on that one and focus on these two. So just a couple more, and I'm going to sort of manipulate the tissues a little bit myself here now. As we're manipulating the tissues, how's the pain doing, Amy?
It's getting less.
Getting less? Good. And that's typically what will happen as people stretch more, as they move more into the pattern, the pain will start to reduce. Okay? So that's good. You okay there?
Mm-hmm.
I'm going to pull these cups off. Good. And that little popping sensation sometimes is a indication of increased energy level. So sometimes we'll actually pull the cups off. If you introduce energy into tissues that lack flow, it increases the local energy level at that area. So after the cupping session, you'll see sometimes these red areas, what we call like Petechiae, and what we'll do is just try and sort of work them out of there. We utilize other techniques such as instrument-assisted soft tissue mobilization just to start to clear and move some of that fluid, which can be good again for the healing process. Okay, so the ultimate test now. Let me see if you can tilt your head to the right and left for me, please, Amy. Okay, very good. And then to the left. And you can see that she's got a little bit more motion to the right now, even though it's still a little tighter than the left. So go a couple more times for me, Amy. So she's getting a lot closer to that shoulder as she did before, but she still has a little bit of tightness. So over a period of like several treatments, we would hope that Amy would start to restore and regain some of that normal range of motion, and this muscle will start to stretch out and become more normalized.